Epstein-Barr virus is one of the most common infections worldwide. About 90 to 95% of the world population has been exposed to it at some point. So most people maybe have heard this as mononucleosis or mono. Maybe in grade school you heard it as the kissing disease. Not every person that is exposed to it will have a very intense sickness, just like all infections that we're exposed to. Some people get the flu really bad, some don't. But these are some general things to think about if maybe you've had it or some of you know has had it before.
Hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmie Brown here with Melissa Gentile. Are you ready to transform your approach to women's preconception care? Do you wonder how chronic infections like Epstein-Barr virus may compromise fertility? Today, we have the pleasure of hosting Dr. Katie Zaremba to help us understand the answers to these questions. Dr. Zaremba is a chiropractic internist and functional medicine specialist dedicated to uncovering the root causes of hormonal imbalances and fertility challenges. With a personal journey that fuels her passion, Dr. Zaremba empowers women to achieve optimal health and realize their dreams of motherhood. We can't wait to jump into this topic today. Dr. Zaremba, thank you so much for being here.
Yeah, thank you for having me. I'm really excited to talk about this topic and to help people learn a little bit more about things they can look for in their life.
Fantastic. So before we get into the fertility piece, I think it's helpful to have a little bit of a review for our listeners. What is Epstein-Barr virus and what does it look like clinically?
Epstein-Barr virus is one of the most common infections worldwide. About 90 to 95% of the world population has been exposed to it at some point. So it's very, very common. Most people maybe have heard this. If they haven't heard it as Epstein-Barr or EBV, I might refer to it as throughout this interview, is something people maybe also have heard of as mononucleosis or mono. Maybe in grade school you heard it as the kissing disease. That's because it's very common in young people, teenagers, college-age students. This is an infection that oftentimes will cause very intense fatigue. Sometimes there can be enlargement of the liver that comes from this. And it's usually self-limiting, so it usually runs its course and then people feel back to normal. Not every person that is exposed to it will have a very intense sickness, just like all infections that we're exposed to. Some people get the flu really bad, some don't. But these are some general things to think about if maybe you've had it or some of you know has had it before.
I did not realize that it was that common. You said 90 to 95%. I didn't realize that it was that far up there.
Yeah.
So is there anything that we can do after like a mono, maybe you go and get a mono test done, you have a diagnosis, you know that you have contracted it, you're having symptoms. Is there anything that we can do to help the body clear it and prevent reactivation?
Yeah. So what's interesting about this particular virus and a lot of viruses is it will live in your body for the rest of your life once you're exposed to it. And how that happens is it goes through periods of being active and latent or periods where you're not affected by it. A lot of times what can trigger the reactivation or maybe some symptoms to come back again can be what we might see with reactivation of other infections like shingles is what people commonly think of. No, not all people will have a shingles outbreak. Some might not. But with Epstein-Barr, there can be periods where this becomes activated. So a lot of times I see this in people maybe who have had other illnesses, like maybe they have had the flu or they traveled or they got food sickness or something that caused some sort of stressor to their immune system in the first place and caused this virus to become reactivated. So to kind of answer your question of how we can recover from it or maybe prevent it is being mindful of just how do we support our immune system. Obviously the big things like hand washing and, be mindful of things like that. But from a supplemental standpoint, you can consider things like vitamin C, zinc, vitamin D. Those are all things that can be helpful in maybe reducing the severity and also preventing a reactivation. I got a little winded on that answer, so I don't know if I answered your question.
Yeah, no, that was a perfect explanation.
There's a lot to unpack there too. And I'm curious, Dr. Zaremba, I think a lot of us remember from our teens that one or maybe two of our classmates who are out for like 1 to 2 months. Mm-hmm. They are just taken out by mono. And a lot of us don't have that experience. We may be exposed and we don't even know it. As you said, upwards of 95% of us are infected. So, and COVID, as you mentioned, and other infections can trigger reactivation. So I wanted to throw that out there too. I think about it as really any stressor. A lot of us are more familiar with cold sores, right? So EBV is a herpes virus, and those sneaky herpes viruses, we may not know that we ever got exposed until we break out in a cold sore at the most inopportune time, right? It's like, again, being teenagers, I remember there was a friend of mine, it was prom, and she gets a cold sore. And it's that stress of everything coming up, and COVID is a stressor, and that's been linked to reactivation of EBV. So wanted to throw that out there also. So now we want to segue into the connection between chronic viral infections, particularly EBV, and infertility. When did you start to notice this connection, or when did you become interested in this connection? Was there a specific case or research paper or moment that you can recall that really got you interested in this?
I worked in a clinic where we were primarily seeing patients that had a lot of chronic issues, not specific to infertility, but I did see a lot of reproductive disorders at that time. And looking at how chronic infections can trigger autoimmunity in a lot of patients. That was a big area of where I was working at in the beginning of my career. So the interest in that kind of built because I'm looking at why do viral infections seem to have such a significant impact on our just overall health, our autoimmune conditions in general compared to different types of things. So that's kind of where my initial interest in that stemmed from. And then, of course, seeing the kind of classic patient that comes to a functional medicine facility of, I don't feel well, but no one can tell me what's wrong with me. And that's the big picture of, I'm fatigued, I have brain fog, I don't feel good. What's wrong with me? But my labs are normal. So that's when I generally start looking into some sort of chronic infection. That's usually a red flag for me of something to look kind of further into.
Which leads me to my next question. Why do you think so many practitioners overlook this? I mean, and I think maybe because it is so ubiquitous, as we already referenced, but also it's linked to some complications. So I'm curious, why do you think so many people remain maybe unaware of its impact?
I think it's because it's so common and there's not a specific treatment per se from like a Western medicine standard where you don't just give an antibiotic for it and, dismiss the patient. It's just kind of wait and see, or it should fix itself. So I think that's a big part of it. I can't really answer the question as to why they don't look further into it, because I think that's why we do what we do. But I think that it tends to be overlooked because of how common it is, and there's not always testing that goes into a typical clinic of, we're not looking at what is the exact infection that's causing this cold that you're having, unless someone is, in the hospital and they can't figure out what's going on. Generally, it's just rest and you'll be okay.
Right. It's a clinical diagnosis. Looks viral.
It's viral. You'll be fine. Stay home, rest, drink fluids.
Yeah. Makes sense. And so I'm curious, when do you start to suspect reactivated EBV? Because as we already said, this is primarily an issue in adolescents, but we know that it can reactivate later on in life. So when do you start to suspect it beyond the routine labs are normal, but they're still struggling? What's specific? And you named a couple of things, but what kind of signs and symptoms are you looking for there?
I would say the most common one is chronic fatigue. When people have fatigue and they don't know where it's coming from, that's usually my first indicator. If there's not a lot of other obvious symptoms, like for instance, we think of the gut quite frequently in the functional medicine world of just causing majority of issues. But if someone maybe doesn't have super obvious digestive symptoms, or they just really aren't having digestive symptoms, it's another thing to consider. The other thing, it may be saying like brain fog is another thing. So when I do an Epstein-Barr workup, I'm usually simultaneously doing a thyroid workup too, just to see, is this, because there's a lot of overlap in those symptoms of the chronic fatigue, the brain fog. maybe inability to maintain focus. And what's hard with these symptoms is they're so broad, and it's so relative to the person experiencing those symptoms. Like my fatigue could be different than someone else's. But the other thing I notice a lot of times too with these patients is after the fact, they usually end up telling me they didn't realize how bad they felt until they felt better. And then they're like, I felt way worse than I thought I did. But chronic fatigue and feeling like they're never rested are probably the two biggest flags for me.
What about myalgias? I feel like that's kind of a feature I think about too.
Yeah, that definitely can be. Sometimes I've seen a handful of patients where maybe they don't necessarily say they have chronic fatigue, but they've had basic labs done and they have liver enzymes come back elevated. That can be an indicator, not necessarily a symptom, but CMPs are pretty standard labs that most people will have from any doctor. So, and I've had a lot of patients that have had elevated liver enzymes, and then they tell me that their doctor told them, "Oh, it's fine." I'm like, okay, I don't think it is. That's probably something we should look further into. So sometimes that's an indicator too. But yes, the myalgias or like the joint. Sometimes people might tell me they have joint pain. It could be kind of non-specific or just general aches and pains that there's not really a pattern to, but just kind of generally feeling unwell.
Right. Yeah. And I think you made a good point, Dr. Zaremba, when you said my fatigue is going to be different than your fatigue. And I think some people don't articulate what they're feeling very well, or at least, they might just say, I'm tired, and it might be physical fatigue. We don't feel well when we hurt. But maybe even if there isn't that physical aspect, just that, like you said, brain fog, overall fatigue, all of those good things to watch out for. And also you mentioned hypothyroid. So, and there's an overlap, and not just the presentation, but maybe having concurrent EBV reactivation and Hashimoto's, which we really want to get into with you. So what is the connection between EBV and autoimmunity, particularly Hashimoto's?
Yeah, so when we see the increased immune activity from a reactivation of an infection like Epstein-Barr, this, of course, is causing a release of more immune cells in the body, which can go anywhere. And when I'm explaining it to patients, I usually say that we all kind of have a weak point. So some people that have issues with the thyroid, or some people may have issues with their thyroid, some people may have issues with their gut, some people may have issues with migraines. And I kind of like to say that that's where genetics plays a role, is where your weak points are. Now, the other factors that aren't necessarily related to our DNA or like what we're made up of can come from the environmental factors. What does your stress management look like? What does your diet look like? What does your just overall nutrition look like? Are you high and are you eating a lot of antioxidants or consuming a lot? Are you just running on caffeine and stress majority of your time and burning through all these things? So those are kind of all factors that I consider.
And then you also speak to the nutrient status, Dr. Zaremba. So when we think about chronic viral infections like EBV, how do these impact our nutrient status and eventually our fertility?
Yeah, so any type of infection is going to use a lot of antioxidants or vitamins in the body. So the most common ones that I talk about, or where there tends to be a lot of research at, is vitamin A, vitamin C, D, E, zinc. There's some on selenium as well, which plays a role with thyroid health. And when there's some sort of active infection, the body is using these nutrients to promote an immune response. So when you're sick, you're using a lot more of these nutrients than just your day-to-day life. What happens with that a lot of times is when you're very actively sick, like when you have the flu, you're probably not really eating as much as you typically are because you feel so awful. But if your body is using these nutrients, there begins to become a deficit. We know that vitamin D and selenium are two that have been highly studied for their ability to play a role in thyroid conversion, or T4 into T3. So if we're starting to see a deficiency in certain nutrients, then we may start seeing hypothyroid. begin to occur. Now, with the reactivated Epstein-Barr, when just like any infection, when there's an increase in immune cells being produced, there's going to be an increase in inflammatory cells that are produced because those things are kind of they happen simultaneously. So as there's an increased immune response and an increased inflammatory response, this can begin to target, in this particular case, may target the thyroid gland. So we may start to see antibodies or these antibodies develop to the thyroid. And a lot of times, especially in the functional medicine world, we will see antibodies develop to the thyroid even before clinical hypothyroidism, or we're seeing it in lab results where your TSH is normal, but you feel like garbage. And then you have these high antibodies, but your doctor's telling you, well, look, we're just going to wait. We're going to wait until those numbers are bad enough, and then we'll do something about it.
If they even order those antibodies. They're just running TSH and call it a day.
Yeah, exactly.
I can imagine it's probably really challenging too, because there is so much overlap between other conditions and reactivated EBV. So when you're working with patients and you're having someone that's coming in and maybe they have thyroid markers that are a little bit off, maybe they also have a little bit of nutrient deficiencies, maybe they have a little bit of a gut imbalance, but not too many symptoms, or maybe they're having like hormonal imbalances and you're kind of throwing a lot of things at it and like nothing's really moving the needle. Is that kind of when you're like, okay, let's start looking at chronic infections? Do you try to address these things from a other perspective first, I guess is my question?
Sure. Yeah. And I think what you're asking, like, for example, fatigue is one of the most common symptoms I probably hear from, I would say, virtually every patient I talk to. And it's so broad because it can come from a vitamin D deficiency. It can be from hypothyroidism. It can just be from very poor sleep or stress management. And it can come from an infection. So in your mind, in my mind, as I'm kind of working through what the differentials or possible diagnosis could be of the condition, I'm trying to ask questions that can rule some things out. Depending on the patient, sometimes they're coming to me and they've had a lot of labs done already, and that makes it easier for me to get from just talking to them to this, like, suspecting it could be Epstein-Barr. Obviously, because I have more information to go off of. But in the cases where I don't, it's just one that I more often will at least test for, because it's pretty inexpensive to look at, and it can give a lot of information if there is, if it is something that's active. So the other thing I meant to say a few minutes ago, that when I'm asking people about their fatigue, that's different when you're talking to adults versus, teenagers, is most adults are going to do whatever it takes to go to their job and work, not call in and not miss work. So if I'm starting to see a patient where their symptoms are getting so severe that they've left their job or they're no longer working because their fatigue is so bad, that's definitely a time that I will look into it. I've had cases where people have known that they've been exposed to mold previously, and that is also something that can trigger reactivation of this infection. So that would be a case where I would also look for it too. And a lot of times I tell adults when I'm kind of asking them, and I say adults because we've talked about teenagers previously, but when I'm talking to them, I'll kind of ask them, I'll tell them the way that the fatigue may present could be you're still able to go to work and do your job and do the things that you have to do in order to adult, essentially. But you probably can't do anything extra, like hobbies, or maybe exercise is difficult because you're so exhausted. So I try to kind of frame that question in a way where, like we were saying, it's also relative. And if it's very gradual, they may not notice how horrible they feel compared to where they were at 6 months ago. Because when it's a reactivation, it's not always as obvious of I wake up in the morning and I'm sick and I have a fever and I feel awful. It's this gradual, over time, you feel worse and worse and worse and worse. So I meant to kind of say that earlier and I forgot. So I wanted to add that in.
No, that's a really good point too, because I think that's really common where people don't realize how fatigued they were until they start feeling better. And they're like, oh my gosh, I have energy and I have clarity and I can think right. And when they've been dealing with something for so long, it's really hard to see that contrast. And I do want to get into the connection between Epstein-Barr and infertility specifically, because you have such a niche specialty of knowledge in this. So how does the reactivation in this virus in general tax the immune system? And how is that like affecting hormone production, hormone levels, want to get into that.
Yeah, so I kind of touched on Hashimoto's or specifically that autoimmune condition, but Epstein-Barr it's associated with other autoimmunity as well, but Hashimoto's is one that there seems to be the most research for, I would say, but other autoimmune conditions can play a role with that. So when we're looking at how autoimmunity can impact someone as an individual, it can also have a pretty significant impact on their overall fertility. The thyroid plays a very big role in the early stages of pregnancy. So if we're looking at infertility from maybe an aspect of recurrent miscarriages, if someone has uncontrolled thyroid disease, that can definitely play a role in the health of the developing fetus. But if we're looking at just the inability for someone to conceive, the thyroid, of course, can play a role as well, because if there's issues with thyroid hormone production, this can impact production of other sex hormones. And we know if there's increased stress, whether it's from a chronic infection or just the constant stress in the immune system with an autoimmune case, this all starts to compound on one another and increasing stress and stress and stress. And I hate saying that stress can cause infertility because it sounds like such a gross way of saying it. And it's not as simple as you're stressed in like a mental state. But I always try to explain to my patients, stress isn't just the mental stress that we think of. It comes from all of the factors of your life. So we have these normal kind of day-to-day stressors like taking care of your home, going to your job, paying your bills that we should be able to just manage and get through. But if now we start adding on to it, you have a chronic infection, and then you have an autoimmune disease that gets triggered. And then maybe you're looking at some vitamin deficiencies. Well, now all of these things are starting to impact your body's ability to produce progesterone. So now you can't get pregnant, or you're struggling to stay pregnant. Or the changes in these types of things can start to affect your gut microbiome. And then your gut microbiome can start to affect your vaginal microbiome. And then because all these things are happening, your body's producing more cortisol, and all of its energy is going into fighting this infection, fighting what it thinks is an infection, but it's just your thyroid, and producing cortisol. So then your body's in this state where its absolute lowest priority is going to be you getting pregnant. And it really is just awful, because when that's the goal of someone that's trying to conceive, it's very frustrating that we can't just make it happen by wanting it. I think that kind of started segueing into this topic a little bit.
Absolutely. It's almost like this snowball effect that just, the one thing is, or the domino effect of like one thing affects the next, which can be very overwhelming for a patient to kind of hear this explained from their practitioner when they're not fully like aware of all these things before. They just come in for some labs because they're tired, and now all of a sudden they're kind of discovering all these new things that are a little bit off in their body. So what are your top recommendations? And you kind of just touched on this, but what are your top recommendations for practitioners when explaining complex viral issues to their patients?
I usually use the analogy of a bucket hanging on a hook. I think a lot of us tend to, where the goal is that the bucket isn't going to spill anything out of it. And we think of dumping water into it as our general day-to-day life, where some water is our bills, some water is our relationships that we're maintaining with family or friends. Some of it is, all these kind of day-to-day things that we generally are able to maintain. However, we start adding more into the bucket where you have this viral infection. And now we're talking about possible autoimmune issues. And maybe some people don't have that, maybe some do. But then maybe we're talking about vitamin deficiencies, like low levels of vitamin D because of this chronic infection, or low levels of vitamin A or zinc, or anything you want to insert here. And all of these antioxidants play a huge role in the overall immune response, but these antioxidants are also very protective to the ovaries and protective to the reproductive organs. And they can help to reduce inflammation around these things. So when we're getting low in those, that also increases inflammation and issues around the reproductive system. So that was kind of I kind of went off a tangent there. But and then talking about all these other things that you can continue to kind of fill the bucket with. And we get to a point where all of a sudden you drop your coffee mug on the kitchen floor and you just have an absolute meltdown because that was the last amount of liquid that dumped your bucket over. And you're going, why am I crying over a mug that I just spilled or something just kind of insignificant? So I tell patients the goal is to reduce the amount of things in your bucket so that you're not going to go over the edge with something that's kind of insignificant, and your body's able to help maintain a level of, I guess, maintenance or just feeling decent to get through your day. So that was kind of a winded one. I don't usually go that in depth with my patients, but I also kind of threw a couple other things in there that I thought were helpful.
No, that was like a perfect picture explanation.
I'm curious when you're talking to patients. So again, a little bit of coaching information I think is always helpful. Where do they start? Because it's like, okay, we don't want to keep adding to the bucket. And I think it can be overwhelming to even understand where to start because you're going to give your recommendations in terms of maybe repleting nutrients and ordering certain tests that are necessary. But where can patients start to maybe refine their day-to-day and try to cut out some stress? How do you coach them on that?
Yeah, so working with women in the fertility realm is challenging because there's generally more of a timeline in their heads than there is from someone that just has gut issues and wants to see improved digestion.
There's more pressure on you.
Yeah, and it's an increase. And I was talking to my husband, who's also a provider, about this. And sometimes it's challenging because with a patient that maybe has chronic digestive issues and they're having diarrhea 15 times a day and constant bloating, their measurement of is what we're doing successful. My bloating's less and I'm going to the bathroom less. 6 weeks from then, they might still be having diarrhea, but if it's now 3 times a day instead of 15 and bloating is 25% of the time, it's still an improvement. Where when you're working with a couple who is their end goal is to get pregnant and have a baby, there's not really a lot of measurements in between there. It's I'm not pregnant yet or I am pregnant. So I think it's very important from the beginning of working with people to kind of talk about what your expectations are for what this timeline might look like, especially because it's the yes or no. We have one or the other. You're pregnant or you're not pregnant. So kind of my approach with that is making sure that I'm giving things to people in a way that's they're able to kind of digest the information, but also not overwhelm them with we're going to do everything at once, because then, like you said, we're just adding more to the bucket at that point of here's your list of 50 things of self-care to do each day.
Totally.
It's like, I don't have 3 hours to do self-care a day. So I usually tell people we're going to do things in phases. I find phases are where I tend to see the most results with my patients rather than trying to do everything at once. I'm sure a lot of providers are similar, but I know everyone kind of has their own approach. So I usually tell people our initial goal is I want to see your periods more regular, and we talk about how to monitor ovulation. A lot of the patients I see know how to track their fertile window and how to know like if they're actually ovulating, but not all of them do, or some of them are just using a period app and they're like, oh, my app says I ovulated. And it's like, well, did you? So a lot of the first initial parts are just kind of education around that, because that also helps them see symptoms as they improve. Because if I never talk to them about how to track their ovulation and they're doing all of these things to help with their Epstein-Barr, and they don't really know how to track ovulation, they might all of a sudden be ovulating super regularly, but not even realize that because they didn't know. And then they're going, well, I'm still not pregnant. But I'm going, yeah, but you weren't ovulating previously and now you're ovulating regularly. So that is a huge improvement.
Absolutely.
So that's kind of a way that I also help educate them. And like you were saying, what are some actual tips for that? The main things we talk about, especially someone that has Epstein-Barr or a viral infection like that, is to not put the expectations too high of, well, you're taking all of this. It is going to take several weeks before you're probably going to notice an improvement. You're not just going to feel better in 3 days. So usually my recommendations are prioritizing sleep at that point, because most people don't sleep enough or have really crappy bedtime routines. So prioritizing 8 hours of sleep a night, it's actually surprising to me how many people get less than that. So prioritizing sleep is a big one. And then I'll ask people a lot what their biggest stressors are. I had a patient who she had went through several rounds of IVF and hadn't had a successful pregnancy yet. And she told me that she was waking up every morning to exercise. And later on in the conversation, she told me that she hated it. And I asked her, I said, why are you getting up in the morning to exercise? And she said, because I thought I was supposed to. So that was a really big conversation of, no, this is not adding, like, this is adding to your bucket. This isn't taking things out of your bucket. I want you to. So we talked about things that she enjoyed doing. Like there was a class that she liked going to, like a dance class, and she liked going for walks with her husband. And I said, prioritize that. Stop getting up in the morning to exercise. And I'm 8 months pregnant now. So that was, that was a piece of her case. But it was something that sometimes it really is simple thing. And if I hadn't asked her that, she'd still be waking up at 4:30 every day to go exercise.
It makes me think to ask the patient, what are you doing that you hate?
Yeah. Yeah, exactly.
Crazy, but I think we're going to be surprised if we ask that question, because in hustle culture is a whole nother conversation.
Yeah.
But just speaking to stress and how it can impact us physically. I mean, that mental, emotional stress. And then, of course, there's the chronic infections, physical stress, but all of it is going to impact us negatively.
Yeah. And I talk about stress as that's probably one of the most common conversations I have with people, because like I was saying earlier, it's not just the mental stress of I'm anxious or I'm feeling stressed. It's all of the other things like the infections and potential autoimmune issues. So a lot of times explaining that to people, and I kind of correlate, and here are all the things that are going on that's causing this big stress response in your body. First, we're going to be addressing your Epstein-Barr. Another thing that we're going to do to reduce your stress is making sure you're getting enough sleep. I'll talk about other stress management techniques like breath work and meditation pretty frequently. But then we also talk about diet and things that they can be implementing in. I've grown as a practitioner, as we all do, in my recommendations, and I've started to find that adding more things into the patient's diet rather than taking away tends to be a lot better.
Yeah, I think that's that's much more well received than you can't do this, you can't do this, you can't do this, or you can't eat that.
Mm-hmm.
So I totally hear you on that one. What are some of those recommendations that you do get from a nutritional perspective?
Biggest thing is I actually have patients keep a food journal for 2 weeks, and I also have them keep a symptom journal. So the symptom journal helps me see if there was something I missed, maybe in our initial consult, and also if it correlates with things that they've eaten that day. And then the food journal helps them see what they're eating, and then it helps me see how I can help them. Because asking someone, I used to ask, what does an average day for you look like? And I realized it's not an average day.
Yes, well said.
It's not. So a lot of times I'll look, and a lot of people skip breakfast. So we talk about the importance of eating in the morning, especially people with chronic fatigue, or if they're dealing with Epstein-Barr or Hashimoto's. They're a lot of times also dealing with weight issues. And so in their mind, eating less in the morning will help with their weight loss. So we talk about kind of the importance of making sure they're getting enough protein in the morning. And then I also have come up just over time with examples for meals that I'll give them, or sample meals, and actually giving them, here is a list of 15 high protein snacks. So here is a list, so they don't have to do the research on their own. So that's something that we'll talk about. And then with a lot of my fertility patients, we'll talk about increasing intake of antioxidant rich foods. So this looks like eating more fruits and vegetables, and talking about the basics of fresh versus frozen versus canned, or what is kind of the best way, because I also don't want people to feel financially stressed. Again, another stressor where they're having to eat all of the super expensive foods. I'm like, no, you can just keep it simple.
What about seed cycling, Dr. Zaremba? Do you implement that ever for?
I do. Yeah. I find for some people they get overwhelmed because one more thing to have to do. So sometimes it's not in the initial appointment. It also depends on what the current diet looks like of the person I'm working with. Like if there's sometimes I see patients where they're eating a kind of heavy processed food diet still. So sometimes my goal is to just get them into like more whole foods, and then we implement things like seed cycling. Sometimes I have patients that have the quote unquote like perfect diet when they come see me, and they're looking for ways to, how can I make this even better? And so we'll implement that in. I also like it because it helps add a lot of fiber into their diet. Yeah. Most people don't eat enough fiber. And just healthy fats too.
Yeah. And I think it's just kind of gets people in the headspace, if they're ready for it, to focus on that self-care and that wellness. Because for those of you who don't know, seed cycling helps harmonize the hormones throughout the month. So they change, the types of seeds change throughout the month, and the follicular phase and the luteal phase. And what it involves is grinding the seeds. I mean, it is cumbersome for sure. As you said, it's not for everybody, but I think for someone who's really excited to get on board and support their fertility, doing that can be just a really beautiful food-based approach. So I like to throw that out there. It's easy to find information on seed cycling, if you Google it. So, okay, let's jump into testing a little bit. I'm curious, I assume that you do test for EBV if it's indicated. And if so, are you ordering antibody panels? What kind of other tests are you looking for? And what kind of patterns are you seeing on those tests that indicate EBV?
Yeah. So when we're looking at that, there's a couple, actually, let me pull the full list up here. I look at a number of things. I'll usually run a CMP, which looks at liver enzymes and kidney markers too, just to kind of be certain, or like see what their actual liver enzymes look like to see if there's an elevation. I'll also usually include C-reactive protein to see what the inflammatory response is. That's another way that we can kind of track that. And then with the actual Epstein-Barr panel, we'll look at several markers. These are going to include immunoglobulins G and M. IgG, if they have had a past infection, will always be elevated. So sometimes I have patients that see it and then they panic. They're like, do I have this? So it's important to make sure that you're interpreting these labs correctly when you are looking at them, because someone might just have it might just show a previous infection. So there's one that you can look at called the early antigen, or it looks like EA when you order it in a marker or in the lab. That one, if it's elevated, can indicate a reactivation of an infection or a new infection. I think most of what we talked about on this call was like reactivation, not first time seeing someone with it. So that would look different. But also if you see IgM, that's going to indicate a current infection. IgG generally just indicates a past or previous infection. So I'm not really surprised when I see that elevated in people, because I assume everyone I see has had it at some point. So those are the main four I would look at. Another thing that you could look further into, if you do see something like elevated liver enzymes and Epstein-Barr comes back normal, obviously there's other things to consider, like what diet and lipids look like, but you may also want to consider other viral infections like CMV. A hepatitis panel may be worth looking if you're not sure where that's coming, where the infection may be coming from. But those are kind of the main ones I would look at from just the general testing standpoint. I typically will also include vitamin D to see where their levels are at. And then I'll also sometimes I'll look at other micronutrients. Vitamin D is kind of the big one. I don't always look at the other ones. And then, like I said, I'll sometimes look at the thyroid and look at antibodies for the thyroid, which would be like thyroid peroxidase or thyroglobulin antibodies. Sometimes it's helpful to look to see if someone maybe has Graves' disease, because they can kind of flip-flop back and forth sometimes between Hashimoto's and Graves'. So that can be relevant to look at as well.
Just quickly, I'm curious, do you assess for toxins with laboratory testing? And how do you like to best do that, if so?
Yeah, so it's not on every patient, because obviously it gets cumbersome or expensive for people to run like every test and
stressful if they've got a lot coming back and it doesn't associate with how they're feeling, or they feel great. I think sometimes we want to be careful about who we're ordering it for.
Yeah, exactly. And it's hard because some of the mycotoxins can be things that you're just being exposed to in a normal environment that don't necessarily mean that there is going to be an obvious issue. Could be something that you ate that when you did that particular test, you tested high for it. Obviously, when you're being exposed to something like black mold, that's more of a concern. But, we have to be careful. And I'm sure, as you know, how we approach this, because I don't want to start planting seeds in patients' minds of here's the list of 500 things that you might have. And then they start spiraling. So I do think that the mycotoxin test can be helpful. Usually I'm more apt to run that. I generally ask if people have, it's part of my usual workup is, are there other people in your house that are sick? Or maybe have other broad symptoms like fatigue or brain fog, or do you have a child in your house that has some sort of like ADHD type symptoms or things like that? So that's kind of sometimes how I'll get to that point. Sometimes I'll ask people, have you ever had any leaks in your home that you're aware of? Do you spend a certain amount of time in your house that no one else in your family does? Like, do you work from home and you're the only person home all day and you're the one that's the most sick? And then also I'll tell people too, you can also just buy at-home kits to do a general test if you're concerned. Obviously, it doesn't rule it all the way out because mold can come from really weird places. Like I had a coworker whose washing machine leaked and it got under their floor. And this was in Colorado where there's no humidity. So mold isn't, it's not like it's Florida. And her son's bedroom shared the wall with the washing machine, and he was the most sick person in the house.
Oh gosh.
He had a lot of allergy issues, and they finally figured out that's what it was. So allergies are sometimes things that I will also ask about. There might be people that talk about having itchy skin, or they're more itchy around their period. Or maybe they're reactive to just a lot of foods, or they think they have a lot of food sensitivities and they're not really sure why. So those are sometimes things that might lead me to looking at mycotoxin or looking for mold exposure. I look at heavy metals or different type of environmental toxins for some people as well, depending on what their job might be. Like I had a patient who this was one of my infertility patients. We had done a heavy metal test on her and her levels of lead came back high in the urine. So I wanted to recheck the blood. And I also told her she should have her husband checked too. And they both tested really high for lead from a serum draw, which was really interesting. So then that kind of opens up where is this coming from? Why do you both have high levels? And then I had another patient who he's like a contractor. So he does a lot of work around all sorts of, I guess, products, and they're supposed to be, so they're not affecting people's reproductive health. But he told me that we did an environmental toxin test on him and his BPA levels came back super high. So that kind of led into the discussion of he drinks from plastic bottles a lot. And then he told me he handles a lot of receipts at work. So he's constantly going through receipts. So then we kind of talked about where that exposure may be coming from and kind of some ways to, like I told him, just get a bottle that you take with you to work every day instead of using just regular water bottles. And he wears gloves when he's doing receipt work now in his office. So their job is kind of sometimes what also points me into what sorts of things should we be looking at.
Yeah, that's really important to take a full evaluation of like, where is this coming from also to reduce the exposure and not just going through just the detox process, but like, where are we actually, getting this from? So I think that's so important. I know we're coming up on the hour here, but I did want to squeeze in like one last question. When it comes to, I know we talked about some nutritional changes and recommendations and upping antioxidants and certain nutrients. What other kind of lifestyle changes do you recommend to improve like immune system resilience?
So I think a lot of it is focusing on, getting the person out of the flare or the reactivation, if you will, but then also just being mindful of, are you in a state where you're not getting outside a lot and your skin isn't exposed and you're just going to have you're at risk for a vitamin D deficiency, and, get your levels checked maybe more periodically throughout the year to see. I think the stress management is a big thing, because when we're more stressed, we're going to use more. There's more of a demand on our immune system, on our endocrine system to produce more cortisol, to maybe produce more glucose, which can then lead into blood sugar handling issues. People that maybe have more sedentary jobs, I'd say get up and walk around every few minutes, or even just if you have a longer break, go for a walk. It doesn't have to be intense exercise. If you're not able to do it, that's fine. So kind of just the general things that most people are probably aware of, and they're probably aware that they're not doing, but just reminding them and providing them ways to kind of do those things. Like, I have people that are like, they hate exercising. So I'm like, okay, well, don't exercise then. Go for a walk, find a podcast you like, find an audiobook you like, and just go for a half-hour walk. You don't have to go to the gym and lift weights. It's not the only way that you can be more active in your life. And I tell people, sometimes if you're at a desk all day, set a timer on your phone to go off if you can, to get up and walk around and have a drink of water.
I think that's one we're all guilty of, being at the desk for far too long, and all of a sudden you realize a couple hours have gone by. But that's an important one there. Well, Dr. Zaremba, it's been such an amazing episode. You are so knowledgeable on this topic, and I'm really excited for our audience to hear everything that you had to share with us today. I feel like we could have gone on with like 100 more questions and gone so much deeper. We might even need a part 2 on one of these topics here, but I'm glad that we did get to address Epstein-Barr, because even myself didn't realize how common it was across the population, and kind of what the symptoms were of the reactivation and how to really come at it from everything that you brought up. So thank you again for coming on the podcast. And if anyone tuning in today resonates with your messaging, wants to get in contact with you, maybe we even have patients listening that want to come and see you for any types of labs or treatment, where can we find you online?
So I'm on Instagram as allnaturaldoc. And then you can also look at my website, drkatiezaremba.com. And my email is info@drkatiezaremba.com.
Awesome. And we'll be sure to link these down below for you guys if you want to get in contact with Dr. Zaremba. And until next week, wishing us all vibrant health and wellness. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. And just a reminder, this podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and hosts are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.